In today's video, I'm going to be talking about ankylosing spondylitis. Ankylosing spondylitis is a type of arthritis that falls under a group of conditions called seronegative spondyloarthropathies. So, breaking that down, seronegative means that patients do not produce rheumatoid factor antibodies, and spondyloarthropathy means that it involves part of the axial skeleton. Remember, the axial skeleton is the vertebral column, ribs and skull. In this particular condition, it is the spine and sacroiliac joints that are affected. The cause isn't clear, but it is most likely a combination of genetic and environmental factors. Before we move on, let's take a quick look at patient demographics. It's most common in Northern European white males over 30, and more males present with the condition at a younger age than women too, as you can see from these two ratios of the age at which patients first present with the condition. A patient describing symptoms of ankylosing spondylitis will likely complain of lower back pain and stiffness, and may say that this wakes them up in the early hours. Usually, they'll find that it reduces at least somewhat by the end of the day, especially with exercise. The pain may also be described as being in the buttocks as well. If the disease has progressed further, their spinal and chest mobility are also reduced, and postural changes can lead to a question mark posture, and here's quite an extreme example to illustrate this. The disease also causes other symptoms around the body that you should be aware of. Patients may have enthesitis, which is when the insertion of tendons and ligaments onto bones become inflamed, and in this case they'll complain of heel or arch pain. Rib cartilage inflammation causes costochondritis, and so pain where the ribs join the sternum. Inflammation at the front of the eye can cause blindness if left untreated. Osteoporosis can cause a back hump and contribute to the question mark posture. There can also be aortic valve insufficiency and fibrosis of the lungs. Ankylosing spondylitis is diagnosed by imaging. In this T2 sagittal MRI, you can see these white spots at the front of the vertebral bodies, caused by erosion and then an attempt at healing it, and we call these shiny corners. And with this MRI from the same patient, you can see bone marrow edema here in the greater trochanter. Moving on to X-rays, in this different patient here, you can see that the sacroiliac joint space is reduced, and again you can see erosion and here subchondral sclerosis. From the same patient, you can see fusion of the lumbar vertebrae, and we call this ankylosis, which is where the ankylosing in ankylosing spondylitis comes from. This leads to a particular hallmark of the disease, which is called bamboo spine. How this happens is that the annulus fibrosis of the intervertebral discs ossify, which causes the vertebral bodies to fuse, giving this appearance of a bamboo stem in the lumbar spine, hence the name bamboo spine. To help alleviate the patient's symptoms, they can work through physical therapy with a physiotherapist. NSAIDs are the main drug therapy used to reduce the pain and inflammation. As the disease progresses, local steroid injections and TNF-alpha blockers can provide some relief. In severe cases, joint replacement surgery may be an option. Surgical correction of postural and spinal deformities is also possible, but risky. Bisphosphonates can also be given if there's osteoporosis. Ankylosing spondylitis is progressive, but there are certain factors that worsen the prognosis. These are an erythrocyte sedimentation rate of greater than 30, because this is a measure of inflammation. Also, if symptoms begin any younger than age 16, if the hips are involved early on, and finally, if NSAIDs don't work well for the patient, prognosis is worse and mortality is increased. So that brings us to the end of today's summary of ankylosing spondylitis. If you found this lesson useful, then be sure to click the subscribe button, and thanks for watching.